connected.
Good evening. I'm Richard Nobles, and I serve as chair of the Licensed Psychology Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. And I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic media. Linda Heitzman Powell.
Present.
David Stevens.
Here.
Abby Callis. Mark Goodman.
Here.
Matthew Golker.
Present.
Jessica Hamilton.
Here.
Edward Hunter.
Here.
Tiffany Johnson. Sarah Kirk.
Here.
Christopher Leonard.
Here.
Jay Middleton.
Here.
And Doug Wright.
Here.
And I note that the following staff member is present, David Fye.
Here.
And it's been told to me that Leslie Allen will log on a bit later. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Richard. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment or answer questions could send a message to the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no time for public comment at this meeting as no individuals requested time for public comment. Because we are conducting this public meeting remotely by conference call and other electronic medium, I state for the record the following information. Public access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended, so we will be conducting this meeting pursuant to the plan. On December 18th, 2024, and later, an updated notice was sent to all the advisory committee individuals who had requested notice of such meetings. We also had posted the notice on the website for the BSRB at ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media materials have been posted on the board's website on the day of the meeting, and they are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if you have any technical issues during the meeting, you may contact the board office by sending an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. I did check the conference call line before we got started. There's no one currently on the line, but if I hear someone beep over and introduce themselves, I will let you know.
Thank you, David. And this meeting is now called to order, and the advisory committee will begin its discussion of the first item on the agenda, and that is to approve the agenda. Everyone has received a copy of the agenda previous to the meeting, and I'll take a motion to approve the agenda.
I approve.
Mark moves. Do I have a second?
Second.
A couple of people seconded. All those in favor, please say aye.
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 All those opposed, same sign. The motion carries. So the next item on our agenda is to review and approve the minutes from our last advisory committee meeting back in December. Everyone again has received the minutes previous to this meeting. Do I have a motion to approve the minutes from the December meeting?
I move we approve the minutes from the December meeting.
Doug moves. Do I have a second?
Second.
There were multiple seconds. Any discussion or any amendments to the minutes? Seeing none, all those in favor of approving the minutes, please say aye.
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 All those
Aye.
opposed, same sign. The ayes have it, the motion carries, and we have a number of things to get to on this this evening's agenda, and we'll begin by Dave giving his executive director's report. Please take it away.
Thank you, Richard. We'll start with some BSRB operations updates and then some legislative updates, and then we'll touch upon a couple items from the most recent board meeting. So first, in terms of BSRB operations, one item that I'm really excited about recently, we were able to close the survey process on a survey that had been open for about a month for 6 of our 7 professions. In the past, we had done a couple of surveys for the social work profession, and during the last year, each of the advisory committees that had not participated in a survey for their licensees before were asked to take part in drafting survey questions. And then each of those committees was weighing in on those types of questions to send out. In the end, we did strive for some uniformity. So some questions did not make the final cut, but we also tried to limit the survey to between 15 and 20 questions to avoid things like survey fatigue. And so was really excited about the results we got back from the survey. It's going to take us a little while to go ahead and summarize all of the data and put together a report. But I've already started working on some of the data review with one of the staff members here in the office. And we're going to go ahead and add a few more licensing specialists to clean up some of the information that we received. Our goal is to have a separate report per profession. And some of those questions were specific to certain levels of licensing. So there will be a couple questions here and there that are just for one level of licensing. But then ultimately, we also hope to have a summary report for the 6 professions that were surveyed, so we can compare some of the same information across professions. So really excited to have some data and really happy with what I've been able to see so far in terms of some of the responses to the survey. You never know when you have open field answers if people will skip that part of the survey, or if they will just add a word here or there. But there were some really thoughtful responses, and I think there's some things the BSRB has already had conversations about doing, and some that I think perhaps we might be able to consider without a lot of financial difficulty or other difficulty. So like I said, I'm really excited about that and happy to share that information once we get it cleaned up and presentable. My goal is hopefully by the next advisory committee meeting in April, we should start to have some of those reports available for review and discussion.
And before you go on, I just want to recognize the presence of Leslie Allen. She has joined our meeting.
Thank you, Richard.
Thank you.
Now, I'll go ahead and touch on a couple of legislative items. So this time of year, the BSRB, as one of state agencies, we do submit a budget request for the legislature every year. So we do that in September. Historically, the governor's office, through the division of the budget, has reviewed state agency submissions. And then the first week of legislative session has come out with a governor's budget recommendation. And the legislature has historically used that as the base to make further adjustments. And each budget is reviewed in a House Budget Committee. Sometimes the Senate uses subcommittees. Sometimes they do full committees to review those budgets, but that's generally the process. It's been that way for many years. This year, the legislature took a different approach. They held some special committees in the fall interim last year and started to review agency budgets independent. And so this year, the governor's budget recommendation was still put out in the beginning of January when the legislative session started, but the legislature was using as a starting point the position of those special committees that met in the fall. And so the budget for the BSRB went before the House Higher Education Budget Committee. The committee did ask us questions, but ultimately they recommended the same amounts that we had submitted for fiscal years 25, 26, and 27. I'm happy to report that we were able to come in just a little under budget from what we were approved for last year, and I think that was well received by the legislature. The agency budget was put together in an appropriations bill for the House, and the House last week ran a number of bills across their floor, including their appropriations bill. This is significantly earlier than in past years, but I think this was a goal for the legislature this session. And so what the Senate has decided to do is, rather than consider budgets at the same time as the House, this year they decided that they would consider budgets at the time that they received the House appropriations bill after it passed. So that bill has passed, been referred to the House Committee or the Senate Committee on Ways and Means. And I received information just this past week that the Ways and Means Committee will likely not have a separate budget hearing for the BSRB's budget. Part of that is because we're one of the smaller agencies from a budgetary perspective. We don't request any money from the state general fund. And so if there are global items that would affect all agencies, we might still be subject to those. But most of the budget process is kind of wrapped up. So happy to report back on that aspect. In terms of other items, there is a number of items that the board has recommended be introduced in bill form. And we did reach out to contact the Office of the Reviser of Statutes. That information was provided to their office in early January. Unfortunately, based on the number of bill requests they received, by the time that draft was available from their office, it was basically too late to introduce it in a non-exempt committee. So we attempted to have it introduced in an exempt committee, like House Appropriations, but we were not able to do so. I've talked to a chair of a Senate exempt committee, and I think there is a decent shot that our bill could be introduced, but we are still waiting to hear back on that process. If the bill does not get introduced this session, it would still be available for us to request introduction of it next year. So I just want to let you know, in case it does not move forward, it is unusual, but there was just a number of factors that we had no control over. So I just want to keep you updated on those things. There have been a number of other bills that have been moving very fast through the legislature. One of those bills is Senate Bill 63, and some of you may be familiar with that bill. It is called the Help Not Harm Bill, is what the bill is self-labeled in that bill. It has to do with prohibiting funding and prohibiting certain acts as it deals with care for transgender or minors seeking transgender care. I know there has been a lot of questions and a lot of confusions about that bill. That bill was introduced as a Senate bill. It did receive a hearing on the Senate side, and then it was passed by the Senate. It did not receive a hearing on the House side through somewhat of an unusual act. It was referred to the Senate as a House Committee of the Whole instead of a House Committee, and was passed without going through the committee process on the House side. It was passed by the House and then sent to the governor's office. The governor's office did veto that bill. It went back to the legislature, and the Senate and House both overturned the veto. The bill had a language at the end of it that said it would become effective upon publication in the Kansas Register, which is also a little unusual. Most bills are effective upon publication in the statute book, which tends to be about July 1st. So the Secretary of State's office has the Kansas Register as one of their publications. It's a weekly publication, and as I understand, that publication of the bill took place this past Thursday. So that bill is now effective. Individuals have started reaching out to the BSRB office about that bill. There is not an official position in terms of the bill. We are still working through that to try to understand it. We cannot provide legal advice to our licensees as far as interpreting statutes or how the bill is affected, but I would encourage anyone who has questions to go ahead and obtain a copy of that bill. And you can get that from the legislative website. It's about 7 pages long. What we normally would tell someone if they contacted our office is we would say we don't provide legal advice, but they may find it helpful to consult with legal counsel if you may find it helpful to do that. So I thought maybe some of your members of this committee might have questions about that because we've already been receiving some. Unfortunately, we can't provide any guidance concerning that bill, just to say that the board is continuing to review that legislation, as is the BSRB, and we're continuing to work through that the best we can. So, I might pause there before I just kind of wrap up a couple items from the last board meeting to see if there's any questions on them. If not, then every advisory committee meeting, I do try to let members of the advisory committee be aware of the items from the last board meeting. The last full board meeting, the special board meeting did take place just yesterday. That was for the board to receive legal counsel concerning legislative items, including Senate Bill 63, the bill that I referenced. But there was also a full board meeting in January. That was on January 13th. At that meeting, there was an individual who provided public comment requesting the board be supportive of an effort for licensure of art therapy this session. There is a bill that was introduced in the House Health and Human Services Committee, but it did not receive a hearing for that. Additionally, there is a group called the Kansas Fights Addiction Grant Review Board. The BSRB is one of the different agencies or entities who has an appointee on the Kansas Fight Addiction Grant Review Board, and Jason Hess is currently the board's appointee to that group. So Jason attended the meeting and provided some comments concerning the work of that group and his role as a member of the review board. Additionally, 2 items I want to make you aware of. The members of the board were provided with all of the updates to this point for the unprofessional conduct regulations. The advisory committees have been working on those for a little bit of time now, and the board was provided with all of the different recommended edits through all the different phases of those reviews. The board was asked to review those in anticipation for discussion and possible action at the next board meeting in March. And also to take a look at any items of inconsistency between the professions to see if the board would like to go ahead and make those uniform or would like to go ahead and leave those as they are currently. And then we also brought to the board some language for a possible expedited application review process. This is something that we have been working on and trying to learn from what other states may have in place or other agencies. There's just not a lot out there to work from. So we've been trying to think outside the box and really define a process that could benefit our licensees in a positive way. And so we did propose something to the board. The board was supportive of some language that we talked about at the last board meeting. So we're going to have that ready for the board to review at the March board meeting as well. Additionally, the recommendations that we had talked about from the last advisory committee meeting concerning the recommended changes to KAR 102-1-12, the education regulation, specifically removing the definition of in residence and including specific language for the coursework that would need to be taken while the person is physically present at a location identified by the institution. So this would make those regulations a bit more in sync with the recent changes to the in-residence definition for the other professions. And there was a similar recommended change from the Master's Level Advisory Committee, Master's Level Psychology Advisory Committee, concerning their regulation, which is KAR 102-4-5A, removing the definition of in-residence, and then having some of their coursework either be synchronous video conferencing, like some of the other professions are allowing, but also for the testing to be done at the physical location identified by the institution, so more similar to your definition in terms of the physical presence requirement. And then there was some language as well. There was a discussion by the Master's Level Psychology Advisory Committee requesting the board be supportive of individuals who wish to take the EPPP prior to waiting for the completion of 3,000 hours. So you might recall there's 2 different levels of permanent licensure under the Master's Level Psychology profession. If someone takes the EPPP and receives a score above a 400, they are able to, and their education meets and all the other requirements are met, they are able to get a Master's Level Psychology license. But for them to receive the independent clinical level, they need to achieve a score of 500 and then also have the 3,000 hours of postgraduate experience. Under the current standards, they would not be able to take the EPPP again until they had satisfied the other requirements for licensure, the 3,000 hours. But the request was made to the board, since it is the same exam that they would be taking, if individuals could go ahead and take the EPPP again prior to completion of the 3,000 hours. The idea being is that if you took the test and you got above a 400, if you had to wait at least 2 years before taking the test again, your score might go down. But if you were able to take it earlier, your score might be improved. And so the board was supportive of that. The board is also supportive of that for the marriage and family therapy profession, as well, as that is the same test that is used for the master's level and the clinical level test, just 2 different tests. With that, I'll go ahead and end my report as an executive director's report and see if there's any questions on any of the items that I talked about.
Any questions for Dave regarding the ED report? Thank you, Dave, as usual, for the report, and we'll move on to an update on SIPAC.
Thank you, Richard. And also feel free to weigh in, as you know, Richard is the SIPAC commissioner for the state of Kansas. But I just wanted to let you know in your packet of material, we did go ahead and include the most recent newsletter from the SIPAC Commission that came out in December of 2024. It just showed the current list of states that are now part of SIPAC. I believe that number is close to 40. And the number of telepsychology active SIPAC APIT is currently at about 12,622. The number of temporary authorizations to practice, or also known as TAPs, is 768. The current number of individuals who are providing teletherapy under SIPAC jurisdiction is 111, and the current individuals providing service under the TAP is 8. And so if you wish to see the totals for the other states, they are included in that report. There will be a mid-year meeting for SIPAC coming up in July, and then an annual meeting later in the year. But that is all that I have for SIPAC. Richard, did you have anything you wanted to speak on for SIPAC?
Yes, I received an email detailing the times and dates for the yearly meeting, and that's going to be November 15th and 16th, and it will be held in Tucson, Arizona, and I will be traveling to Tucson to be at that meeting.
That's great.
Any questions about the update from SIPAC? Seeing none, I'll move us right along to the continuation of our annual training.
Thank you, Richard. And if you don't mind, we have about half an hour of the training left. I know I wanted to go ahead and allow Leslie the opportunity to kind of weigh in on some of the other discussion topics while she was able to attend part of the meeting today. So if we could just save the training till the last half hour of the meeting, maybe that would allow us to kind of talk about the other items, and then we could complete the training at the end, if that's okay with you.
That is totally fine. So we will move that down to about the 7:30 point, and I'll move us on then to a discussion on old business. And the topic that we have under old business is a discussion or a continued discussion on the regulation of artificial intelligence. And Dave, I'll have you kick us off.
Okay. In your packet of material, I did include a few different documents for you. Part of this is as we are trying to figure out the board's position and how the board of the BSRB can be helpful in the regulation of artificial intelligence. We want to make sure that we're learning about artificial intelligence to make sure that we understand it as well. So one of the documents that I provided in your packet is it's a generative policy on artificial intelligence. And this is something that was provided to all executive level state agencies back in the middle of 2023. It was something from governor's office, but we received it as part of the material we get from the Office of Information Technology Services, OITS. And it basically detailed certain types of artificial intelligence like ChatGPT, OpenAI, and it sort of identified what some of the uses, some of the things that we can use artificial intelligence for, and some of the things that we are not able to use it for as a state agency. And so I thought it might be helpful for you just to see from the perspective of a state agency what direction we have been receiving. Now, when we received this policy, we didn't receive any kind of a lengthy training or an explanation concerning some of these terms. So just wanted to kind of add it to your list of items to review, but I thought you might find that interesting and kind of helpful. Additionally, in your packet of material, there is a document from the American Association of State Counseling Boards. I know it's a different profession, but it is about a 6-page document that talks about supporting the safe and ethical use of artificial intelligence and mental health counseling. And I thought that document was interesting. It came out in November of 2024. It has some AI education for boards, talking about clinical tools, practice management, administrative tools, communication and collaborative tools, and also client engagement tools. I thought that document had a nice guidance for boards in terms of things to consider when looking to see what policies should be adopted. And so wanted to add that to your toolkit as we continue to look at different policies on artificial intelligence. And then most recently, there was another document that was put out. This is a large document. One of the groups that was part of the several entities that took part in this is the Kansas Health Institute, or KHI, and KHI put together a template. The report itself is about 76 pages, and it is called Developing Artificial Intelligence Policies for Public Health Organizations. And I thought that document, which came out in January of 2025, was really interesting. Thought it handled some different topics like data privacy, the role of human oversight when it came to using artificial intelligence, why it's important to have transparency about what's being used, what's in your policies. But then there's also some different aspects here, including training and different things like that. So, like I said, I just kind of wanted to add more tools to your toolkit as we educate ourselves about artificial intelligence, and so that you can see some of the other conversations that are going on in different realms. So I'll probably pause there and open it up and see if anyone had any thoughts as they reviewed those documents in preparation for this meeting.
I have a question. This is to Sarah. Did you at some point say that the APA had published guidelines when it comes to AI, or am I misremembering?
I don't know that they publish guidelines, but they have sent out some guidance, some materials. I've really just kind of banked most of that, Richard. I haven't really reviewed it in detail. I believe it's on the practice directorate, that particular part of APA, but I would have to go back and look to verify that.
Okay.
I've been just banking a lot of this stuff because our program and KU is still working on that. And actually, and Ned, I know this is probably at KUMC as well, but I have a HIPAA privacy team that I'm part of, and they actually haven't developed detailed guidelines yet. So this is
Okay.
still completely a work in progress here. So I just don't think anyone is there yet, if you will. So I've just been banking all the information because I feel like I can't necessarily be the pioneer at a tiny training clinic to construct the policy for the university. So I've been kind of waiting to get more detailed information from the powers that be. So
Sure. No, I
but
appreciate that.
I could search for that and send it, but yeah, I've just kind of probably banked it in my AI folder, and I can look for it.
I can also look on the website. I appreciate you looking through your materials too.
And then David, I'm sorry to really bother you, but honestly, I was just looking for the materials you sent, and I must have sorted them to the wrong subfolder. I can't find them. Is there any way you could resend those documents to everybody?
Sure.
Thank you.
No problem.
Ned, were you going to say something?
No, I was just going to say that we're kind of in the same place as Sarah is, trying to weed through things, and no policies that I'm aware of here on the medical campus.
Yeah, I'm also on the medical campus, and I don't think, or I haven't received any guidelines or any parameters around which we should kind of guide our use of AI.
Richard, I just found it. So on 1/15/2025, if you're a member of APA, they sent out an e-booklet for artificial intelligence. And that is what I was referring to. I think that they were going to push that out, and then we did get it.
Okay.
It came from just membershipinfo.apa.org. So if you're a member, it should have gotten pushed out to you, and then you can just download the whole thing.
Okay. Would you be so kind as to send that to me and Dave, and we could send that out to the members?
Yeah. Yeah, and I think you can just use the link and access it. I think anybody can. So, because I think it's one of those things that's they're putting out for public consumption.
Okay. Anyone else have any questions or preliminary thoughts about ways in which to kind of put parameters around or thinking about putting parameters around the use of AI or any particular concerns people have that when it comes to the implementation of the technology?
I think really going back to our meeting in December, the two main principles that I took away from that meeting and I think are still true is maybe if there's just a way to remind psychologists that all of our ethics and our obligations for everything else still apply because AI is such a broad and ever-changing field. I don't think we can give specifics, but just reminding them that all of our requirements remain the same. And then the other component I think that's important is I think psychologists shouldn't allow AI to replace their own clinical judgment and their own professional judgment overall. So for me, everything I've read and everything I look at just keeps bringing me back to those two principles because I think it's such a moving target. We could never give detailed specifics on how to interact with AI because as soon as we do, AI will be doing something different and have a different approach. So I think just those guiding principles is where my mind goes.
I appreciate you bringing that back up, Doug. And yes, I think that especially the first point about, well, actually both of the points, the matter of remembering that we still have to adhere to our ethics code. And secondly, we also need to be reminded that we should not replace our own clinical judgment with the use of artificial intelligence. I will say that I am, with respect to the second point, I am particularly interested in psychologists not replacing their own interpretation and integration of psychological assessment results. That's something that really kind of sticks out in my mind that's specific to our profession.
I would definitely agree with that. I know in my practice we do so much testing, huge amounts of testing, and doing it over decades and using the clinical judgment that I've learned all these decades has helped me tremendously in being able to interpret things without the use of computer generated information. I just find that to be so important that just the human brain itself and being able to use your own with all the years of practice. I think that's so invaluable. I agree with you.
I think the two things, Richard, that at least came when I was having this meeting with the privacy group was it's kind of like, I agree completely with Doug. It's kind of twofold. One is whatever the profession is, psychology, speech and hearing, these people all come from different professions. Those ethics guide your behavior, like you said, and those principles are probably going to apply to AI, just like other technologies that have emerged. The second piece is the privacy issue, and I think that's just much more technological. And right now, we really don't have, although there can be things developed, which I know Ned probably and you were exposed to at the Med Center with electronic medical records. There has to be a lot of things in place to give us that certainty that whatever that AI technology is going to be safe as far as privacy goes and meeting those guidelines. And our HIPAA privacy group, at least, again, wasn't ready to say that, like you said, we can describe the technological aspects because they're evolving, they're changing. But yeah, it's undoubted. It's just not. I mean, there's no doubt there's going to be electronic medical record facets that are going to be developed to use AI. They're already in place, and probably some at KU Med. So,
I would like to second some of that information regarding the use of AI already in the therapy room. I know my graduate program, we have a doc intern, and they had access to a program in their training with that like assisted in notes, I believe, and like listen to sessions. And then I know there's another university counseling center in Florida that uses an AI program that helps review their notes, and they hadn't, and it listens to their sessions. It also didn't activate this like additional feature, which was it could actually give feedback to the trainee if they were doing CBT interventions correctly or right. And so that is already active in other states. And I agree with everybody, because one of the things I struggle with is I think it should be clear that you shouldn't put client information in the chat GPT, because that's AI. And at the same time, there's already like AI in EMRs. So you just can't say that statement that you can't put clinical information in the AI, because it already within those. Yeah. So it's tricky.
No, Chris, I think that it's something that we will continue to have to revisit. And Sarah, I'm glad that you brought up the matter of privacy, because that is going to be, I think, if not the most important thing when it comes to the integration of AI. That, and of course, adhering to our ethics code and to guiding principles within it. I think that yes, we have to be very mindful when it comes to the information that gets put in. But to Chris's point, it's already happening. It's already there. So that would make us, I think, even that should make us even more mindful of how we engage the technology use and how to dispose of information appropriately, and all those sorts of things associated with privacy.
And I think kind of adjacent to privacy is really informed consent. I think if we're getting appropriate informed consent from our clients, that's also going to help us do our due diligence on the privacy side, because you need to be able to disclose how this information could be used or who has access to it. I think that informed consent for clients, if we're outlining that, means we've done our due diligence to say this AI technology, whether it's helped me write my note or whatever, what happens to that information. And I've said on several of those demos of different companies that have the AI technology to listen to your session and kind of start a note for you. Some seem to have done a good job with HIPAA type of concerns, and others not so much. And it's just a reminder that we have to do our due diligence and truly know, are they data mining that? What's happening with that information? And then I think we have to inform our clients about that and let them have the option to, consent to that or decline that.
That I think is a really important point, and that's something that would, especially for those who are in private practice, the inclusion of that in the notice of privacy practices, and the notification of that within informed consent, maybe even having its own informed consent form. It would, depending upon the practitioner and their capabilities. I think that that's a really astute point. Anyone else have any thoughts or questions about this topic?
So I do want to let you all know there was a survey question on artificial intelligence, which many of you may have answered when you took the survey. And it asked, do you currently use artificial intelligence in your practice? And if so, which tools are you using? And so by the next meeting, we should have a few concrete examples of tools that individuals have basically said they're using. The results are anonymous in terms of, we don't know who said what information in the survey, but we do have good information. Just from my initial review of some of the answers, there were a few different things that were listed. So that'll be interesting to see, because that'll kind of point us in certain directions for certain technologies. And, one of the things we've talked about is we may not all be in agreement with what is artificial intelligence or not. So there might be a few things that are a little outside of what we've already been looking at. So.
Well, thank you. And this is a discussion that we certainly could return to, especially as we receive more information. Mm-hmm. So that being said, I'll move us on to new business. We have a few points under new business. The first is a discussion on the postgraduate year requirement for licensure. Dave, I'll have you to frame this discussion.
Okay. And I will probably defer some of this to Leslie Allen. She's the Assistant Director and Licensing Manager, and she can probably describe better than I some of the details about that license, that postdoc year. and then at least maybe one or two of the surrounding states and what they require or what they will accept for that. But you know, you may recall at one of the recent advisory committee meetings, there was an individual who had requested public comment time. That was a representative from the Kansas Psychological Association who had basically submitted a proposal to the advisory committee to consider recommending to the board more flexibility in terms of how that postdoc year could be handled. Not necessarily saying that it should be eliminated completely, but that perhaps people could start attaining those hours prior to completion of, you know, not having it solely as a postdoc year, but allowing some of those hours in advance. But if someone wanted to go ahead and do the current process, that would also be allowable too. And so I'll go ahead and turn it over to Leslie, and maybe Leslie can explain a little bit about the current requirement, and then maybe what she's familiar with in terms of some of the other states, what they allow. And then maybe she can give some input to this conversation as well.
So currently we require at least 1 year of postdoc. Most people do 1 year pre-doc internship and 1 year postdoc. Other states that I have seen, what they allow is that like practicum during the doctoral program be allowed to count towards the total. Like ours is 3,600 hours of supervised experience before you get licensed. So other states allow them to use practicum hours toward that. And if they don't have the total of 3,600, then they would also do postdoc hours. So it doesn't necessarily eliminate it, but it could shrink how many hours or how many months of supervised experience one would be required to accrue before getting their psychology license.
I think two of the points that maybe the guest presenter at one of the past meetings had brought up is that at least in the information that he was providing, this could potentially make Kansas more competitive with some of the states that allow that, because people could enter the workforce a little bit earlier. And then also from a financial perspective, individuals can start earning money a little bit earlier too. I do remember those being a couple of the points that were brought up. So just wanted to carry those forward to this meeting. But I'm curious about all of you and your thoughts on this topic. If there would be a consensus, that would be a recommendation to the board, but that doesn't necessarily mean that this is something that should be recommended. Just kind of wanted to hear your thoughts on this topic too.
And I would add, I think that, I know Missouri has eliminated its postdoc requirement, and it did so. I think more than 5 years ago that took place, less than 10, I think. So that's just one of the neighboring states that does not require, that no longer requires a postdoc. I can't remember the mix of hours that would be included in the necessary number of hours to have before becoming licensed in terms of supervised practice. But I do remember that Missouri no longer has the postdoc.
I do a ton of these attestations for our students because there's so many states now that do count the pre-doc hours. So I'm really accustomed to dealing with those attestations. I'm personally very supportive of it, and it's mainly just because I think we need to recruit people into our field. We need more psychologists. Kansas desperately needs more psychologists. I don't see that there's a big training drop off in terms of, you know, again, all the arguments are out there comparing ourselves to other fields, et cetera. I think if students have attestations from a good program that has good, solid pre-doc training, I have no issue with it. That's just, again, that's just my opinion. I think for us to be competing with some of our neighboring states and just states in general, because so many states have moved in this direction, it would be great for Kansas to allow pre-doc hours.
I totally agree with you, Sarah, 100%. Just yesterday, I had someone drive from Kansas City to my office because there's a 2-year waiting period to get tested, and another group came from Pittsburgh, Kansas, all the way to Hutchinson just yesterday. And I mean, it's sad. And there's a 2-year waiting period at Horizons Mental Health Center in Hutchinson right now to get tested. It's unreal. So I come terrible shortage. 100% agree with you.
And with there just being, 1,100 psychologists in Kansas, and certainly not all of us are engaging in psychological assessment. There is a significant, and in some areas a severe shortage of psychologists who would be able to perform psychological assessments. And I think that this would just personally, I think that this could be really helpful in reducing some of the strain that Mark is referencing and that Sarah is referencing. And I would, though, invite anyone to comment on any of the cons associated with this, because it is an important decision, and we're certainly not going to make a decision tonight, but would want to hear what other people have to say.
I'm not a con. I'm definitely in support of it. I think for a number of reasons. One, the testing need that is out there. And then another thing, working at a mental health center where I see people with all sorts of licenses, and I see how courts and medical professionals and lots of people see psychologists when they have that temporary license. In their mind, they somehow equate that to being somebody who's less skilled than our fully licensed master's level clinicians, which as a psychologist, I think is kind of crazy, but most of the world doesn't understand the distinction, and they just say, oh, well, this is a temporary licensed person, so they must be less well trained or less experienced. And so I've seen cases where people are treated or even tested by master's level clinicians who may be great master's level clinicians, but I think it's hurting the public when we put out the possible misinformation that this person's somehow less skilled than some of the master's level folks. So I'm in support of counting the pre-doc hours.
Thank you for that, Doug. I had not been exposed to the perspective that you just gave, and that is, yeah, that's a little bit disconcerting, and I think a really good point to make with respect to this argument. Anybody else have any thoughts or would want to contribute anything to this discussion?
I'm supportive of this. I think this will help also with clinics and centers that maybe don't have psychologists being more willing to take on a psychologist because they're not going to be worrying about who's going to be doing the supervision. This person's outside of our organization, but they'll be able to move right into an organization. So I'm very pro for this.
And that's particularly a concern in our more rural areas in Kansas, so in the Northwest and in the Southwest, quite frankly, just about everywhere across the state.
I had kind of an interesting thought as we were talking about this, which is, it's been the case for years and years in the past that this year was required. I wonder who came up with that originally and why.
That's a really good question. And it seems like a whole number of states had the postdoc requirement, and it may have just been a thing that had proliferated across the states. I don't know, but it seems as though people are, or states are kind of pulling away a little bit from a hard-nosed requirement.
I know back in my day, and this is 50 years ago, I realized that after my pre-doc internship, the director of the program said, Mark, I want you to do a postdoc. So I was lucky enough to get at the medical school of Chapel Hill and did a postdoc there. I know that type of thinking was definitely prevalent back in the mid-70s during that time, but we didn't have the crisis that we're having now during that time period. That's the difference. They were really big on that in those days.
So it goes back, like Mark said, to at least the 70s.
Definitely.
So it seems like in terms of where we are, a number of you have weighed in and have indicated being in the affirmative when it comes to doing something with the postdoc requirement. Maybe we could have further discussion as to how we would want to codify this in regulation, or this would actually, Dave, this would go to statute, right? Because it's in statutes, the year-long postdoc requirement.
No, sorry, Dave.
Go for it. Right. Yeah.
Oh,
Let's
it's in regulation?
let's
Uh-huh.
talk about that. But yeah, let's see. Why don't you go ahead and explain where this would fall?
Yeah, I was waiting till you guys were done, but I was gonna let you know that in statute, it just says they have to have 2 years of supervised experience. And it does not say pre or post doc for the experience, so it would only be a regulation change. I mean, it would be we'd have to make, because now we don't say anything like if it's not APA accredited, we don't say anything about practicum. The only thing we speak to is the 1-year internship. So we would need to change the education regulation and then also the supervision regulation that speaks to both pre and postdoc, but it wouldn't require a statute change.
Okay, that's good to know. We wouldn't have to run it through the legislature. We would only have to run it through. We'd have to run it through here, and then we run it up to the board. But we could pursue that process if people are in favor of it, and I can talk with Leslie and with David about what the next steps would be in terms of that process.
I did just want to throw one other thing out that occurs to me as I'm kind of going over this in my mind. And, I would, for grins, I entered into AI, well, more than for grins, states that do and don't require. And like California, New York, the bigger states, still do have this requirement of a postdoctoral year of supervised experience. I have a little bit of worry. It occurred to me as I was thinking about it more, about reciprocity and about, whether somebody would be able to transfer. I know we had somebody that went to West Virginia where they don't have this requirement. And, then what happens if he tries to get a license in California? Well, he might have to do, doctoral supervision at 45 or something.
Yeah, that's the conversation I have with my students over and over again. It's the risk you run because we don't have a state by state standard. So basically, there are many states where it'll be just fine. There's people that, of course, if you work in the VA system, it doesn't matter. So it's a risk you run, Ned, but I think you run it in lots of different states. If you choose to go with that route of getting licensure with just the pre-doc hours, or a percentage of the pre-doc hours, it depends on the state. I still think that's kind of up to the kind of buyer beware. It's up to the individual to make that decision. I still think to recruit people to the medical centers, the private practices, the community mental health centers, and the educational institutions, this would be a huge plus. It happens all the time here, is that we need people to supervise students, but they can't. And a lot of times they don't want to pursue licensure because they don't want to do the postdoc supervision. So it would help a lot, even just for creating people that can supervise trainees.
Yeah, and I've been under the experience too that some places, some students or some postdoctoral folks will request supervision anyway for that year as part of the negotiation. So if they do decide to move, they have that year of supervision under their belt.
I was just going to say that I know we have a lot of people coming from Missouri and for reciprocity, and many of them still have a year of postdoc. So it
That's
doesn't
interesting.
discourage everyone. There's still a lot of people doing the year.
That's good to know. I know that where I did my PhD in Washington State, and to the point about reciprocity, yes, in Washington State you don't have to have a postdoc, but California you do. And the folks who want to go down I-5 to San Francisco or wherever, they have to be very mindful of the reciprocity matter. And California is a little bit of an anomaly when it comes to reciprocity and when it comes to licensing anyway, but that's a whole different story. That's a whole different conversation.
I
But
hate doing anything for New York or California because it's a real pain.
it is. Those two are the big ones, and those two still have pretty strict requirements. So, but I like your points there. It's like, well, there is a buyer's beware matter here, and so long that you are aware of the advantages and disadvantages of taking whichever route, that is certainly that's certainly something that you just have to keep in mind. So.
Richard, I think it's also worth noting that there is a trend with states, at least over the last 5 years, there has been a push to pass what is sometimes referred to as universal licensure. It has not passed in every state, and a lot of states have little tweaks that are different, but it tends to focus on how many years you practice in your state with a similar scope of practice versus the specific requirements for licensure. And not all states have, like I said, the universal licensure has not passed in all states, but a number of states recently have passed it. Kansas has a version of the universal licensure that passed back in 2021 that really focuses on military members, military spouses, people that live in Kansas, and those that intend to live in Kansas. And so I only anticipate more states passing similar laws. So while you can't guarantee if a state will do that, I think there's a trend of states moving in that direction too, which could help out with the reciprocity type things as well.
And
Thank you.
SciPact also, many of the states that belong to SciPact don't require a postdoc. So they're coming by telehealth and practicing here, so.
So this was a very good discussion, and again, we'll circle back to this in the near future, and I'll talk to Dave and Leslie about the discussion that we've had here tonight. I'll move us along a little bit. We are at the top of the 7 o'clock hour, and we still have our training. We have maybe 2 more items under new business. I'll introduce the first under B, and that is a discussion on APA's draft of the revised ethics code. Public comment closes a little under a month from now. You can go onto APA's website to read the draft and to make public comment on it, but I'll have Dave frame our discussion.
Thank you, Richard. Yeah, we were made aware that APA does have open for public comment a revised edition of the Ethical Principles of Psychologists and Code of Conduct. And in talking to some of my colleagues from other states, it is interesting. In Kansas, what we have are unprofessional conduct regulations. And in the past, legal counsel has basically encouraged us to have independent language in terms of that standard. That way, if a third party that we are basing our unprofessional conduct on, well, let's just say there's a number of states that may adopt an ethics code as part of its unprofessional conduct standard. But then one of the issues with that is that if the third party changes and you are just bound to whatever they have, you may be automatically bound to something that your board has not agreed to. And so our legal counsel in the past has said you can use the same language, but we would strongly encourage you not to tie yourself to recommendations by another entity. So that way you are the ones making the decision of when you want to make changes and what you're holding your licensees to. Additionally, we've talked about how there's at least 3 different levels of practice. And for some associations, they might put out an ethics code that would include things that are aspirational. Maybe you would talk about how frequently a licensee is expected to publish materials or things like that. Well, those types of things are not going to drive complaints to the BSRB. We're probably not going to get a complaint against somebody for not publishing enough. We focus on is unprofessional conduct, that if you commit certain violations, you will face disciplinary remedies. And so that is part of the reason why we have not adopted a code in the past, but some of the things that could be included in a code could influence what is language in the unprofessional conduct regulation. And when I talked about the 3 different levels of practice, I'm talking about, the gold level standard, the aspirational standard, the level at the bottom that we're looking at for unprofessional conduct, and then maybe the gray area in between where maybe it's not best practice, but it's also not so bad that you're going to be penalized for that. And so our unprofessional conduct standard really looks at if you do something in this area, this will result in a penalty. And we have not tied ourselves to a code of ethics. But since the code of ethics was out there, and I did talk to some of my colleagues in other states, some of them mentioned that their states do adopt it and use it as the base for their unprofessional conduct. So I did want to give you all the opportunity to review the most recent draft. And as Richard said, it is open for public comment through, I think, March 19th. And so if you saw any items in that, those could be items for the board to consider when the board makes final recommendations on the unprofessional conduct regulations. Or if you are part of APA and you do have thoughts about that, want to give you the opportunity to be able to reach out to that group to provide public comment. So, and any thoughts about anything you saw in the most recent update for that document?
I'll be the first to admit that I have not reviewed them thoroughly yet. I do intend to do so before public comment closes. I would say that the APA has APA does this around every 10 years. It appears that the last revision was in 2016. And I would think that, well, I'm on APA's site now, and it reads, it has been over 20 years since APA's current ethical principles of psychologists and code of conduct was adopted. So it's been more like, it's been 20 years. But there were amendments in 2010 and 2016.
Well, I do know that in some circles, there are some parts of it that have become quite controversial. I don't have a personal opinion on some of those controversies that people are discussing. But Richard, I think we do have to wait until public comment settles and they come out with an actual, this is the final version. Because there definitely were some individuals that had quite a bit of feedback about certain sections.
Mm-hmm. No, thank you for that. I appreciate it. Well, I would encourage all of us to make public comment. This is a document that that guides the directions down which we go when it comes to working with clients and also research and a whole number of areas that psychologists are involved. So again, it closes, public comment closes on the 19th of March, 2025. And seeing that there are no other comments, I'll move us right along to the third item under new business, and that is a potential discussion on other topics that we could cover here in our group in 2025. Dave, I'll have you take it away.
Okay. And so, every year the advisory committee can have a good discussion about things we'd like to look forward to reviewing as a group. One thing that we have done on behalf of the board is we have been taking sets of the regulations the last few years and bringing those before the advisory committee to make sure that those are updated and current. And part of that is because of a bill that passed the legislature about 2 to 3 years ago. It put all agencies on a 5-year rotation that said whenever these agencies are up, they will have to justify that all of their regulations are necessary for the implementation of state law. And it really does call for agencies to be good stewards of the regulations and to be able to justify their existence. And so that is why over the last couple of years, we have brought things like the unprofessional conduct standards to you, the continuing education regulations, some items concerning use of computer technology, and other just odds and ends regulations. And I can say that we are in a pretty good spot in terms of those. We may have a couple more that we bring towards your committee for the next year to review, but I think we're on a good pace. We come up in 2026, so we still have a little bit of time, but we want to be ready when that does occur. But there's also 2 topics that will be timely when we meet again in April. One is that we will have those reports from the survey results. So we'll be able to review those, and those can point the advisory committee in certain directions. If you want to look at some of those topics that emerged from the survey results, I think that would be a good idea. And then also about this time of year in April, we start looking at advisory committee membership. And I have not recently looked at your advisory committee to see if anyone is going to come upon the end of how long that you can serve on the advisory committee, but it's usually about this time that if there's any open position, I ask the advisory committees if they would like me to send out a letter to licensees to recruit new members to the advisory committee or to make people aware that they can submit materials. And so I just pulled up the most recent list of advisory committee terms. It looks like for your advisory committee, you have 2 members that would be reaching the end of their 4th term. That would be Abby Callis and also Doug Wright would reach the end of your 4th term, and that's the most that you can serve consecutively on the advisory committee. The advisory committee policy was recently changed by the board to allow advisory committee members to serve future years, but there would still need to be a gap of at least 2 years after your 4th term. So Abby and Doug will need to come off the advisory committee at the end of June. So that does open up a couple positions on the advisory committee. So that is something you could talk about at the April meeting if you'd like me to go ahead and send out that message to candidates to join the advisory committee. So those were basically 3 of the topics I wanted to bring to you. But if there's other major topics that you would want the advisory committee to discuss and work on this year, maybe we can just open it up for discussion.
I'd like to share something, and I may be the only one in Kansas that does this. I mean, as of right now, I spent 5 years training in psychopharmacology, and 7 states now will allow psychologists to prescribe medication. There are 7 states now. Utah is the latest one that approved it, I believe, in spring of 2024. And I really think that it's important, especially in certain areas like private practice, for example, for clinicians, licensed psychologists to be familiar, at least familiar with mental health medications and how they affect the mind and the body, and at least a general understanding. And then for those that want to pursue, being able to prescribe medication, again, we have 7 states now. It's been a battle. It's against psychiatry for all these years. It started with New Mexico, then it went to Louisiana, and I believe Illinois and Iowa now allow us to prescribe, in Idaho, and I'm missing one, and then Utah and maybe Colorado. I'm not sure the 7th state, but more and more it's becoming. I just think I'm not here to compete against psychiatry, okay, but I am here to. I believe that one-stop shopping can occur with people that are well trained, and I just believe that having knowledge of psychotropic medications, and then again, if you want to prescribe, like New Mexico is the first state that has allowed us to prescribe, and several people when I went through the training back in the 90s, are prescribing in New Mexico, actually. Some of them may have retired because I'm 76 years old just about now. So, but I just see that as a way for the future that could help our field. Because I can't remember, it might have been Doug. A lot of people had mentioned, a lot of people don't know the differences in degrees when they get counseling, like between a social worker or someone with a BA degree or an MA degree. And I think that this will help solidify our position of one of respect as well, being able to receive training where we'll be able to eventually prescribe in all 50 states down the road. So, if nobody else wants to discuss this in Kansas, I respect that. I know at the time, I think I was the only one in the state that went through the program at the time with prescribing psychologist register. I'm glad I did. It was a heck of a lot of work, 5 years it took, but it was worth it. And then we had to pass a board exam in psychopharmacology to be able to prescribe medication, have 100 hours of lab study and patients that we had to keep track of during that time too. But I'll stop there. I just want to share that as a possible topic of discussion. That's all, this year or next year, whatever. Thanks for listening to me.
No, thank you. I have a follow-up question for you, Mark. It has, I think it still is the case that there are only a few programs in the country that are enrolling students to become certified to prescribe. Do you have a sense of how many programs there are?
I've lost track of that recently. I know there was definitely one in Louisiana that that had a master's degree program that allowed, psychologists, licensed psychologists to get training in that area. And I would need to do some research for the advisory committee. I realize I need to, because I know there's some other programs that have opened up. I was shocked when I found out that Utah, being a conservative state, just passed a bill in April 2024. I do pro bono work for BYU, where I got my doctor's degree every year, and I'm in contact with the director of clinical training out there. And I was just thrilled. And they're going to have a medical school out there too, which is wonderful. Brand new medical school at BYU as well. But anyway, I need to do some more research on that. I really do. But I just think this is an important area, and we need to distinguish ourselves, and we deserve the same respect, if not more, than any other, at least equal to psychiatry or anybody else. I feel strongly about that. I've always felt that way my whole career. I'm just as good as any psychiatrist, even with the medication, as long as it's mental health medications. I'm not a specialist in medications and the other ones, although I'm real familiar with them because I deal with them all the time now as part of my practice. But I just want to see us be right at the top of the group as far as professionally and what we can do for our patients, especially.
Oh, thank you. I appreciate the comments. Anyone else have any thoughts?
Well, I just want to second Mark's comments. I went to graduate school at Louisiana Tech and was supervised by, I think the term, the abbreviation down there is MP, medical psychologist, who had prescriber privileges. And I'm in favor of exploring that. It was just a wonderful experience being supervised and trained by folks who had knowledge in medication and psychotherapy. It also helped. One of the reasons Louisiana, from what was explained to me, was and Kansas is very similar, a lot of rural areas that did not have hardly any, psychologists, doctors, nurses. There was counties where, you'd have 30, 40,000 people and maybe one or two prescribers. And so part of the reason they did that was to open up, to give people more access to psychiatric medications. And from what I saw, and again, I didn't dig into the research, but it was incredibly helpful and effective in giving people access to care. And so I think it's worth exploring. I know that that is a subject that would require a whole lot of different mechanisms in Kansas, but I think it is one worth exploring.
No, thank you, Jay. I appreciate it. Matt, you look like you were going to say something.
I'll triple down. So quick Google search, the APA website Prescription Authority Program has 6 psychopharm programs on it right now. Various locations, none of them Kansas. The other element, the DoD has been doing this for 15, 20 years. I did my internship, military internship for the DoD, and they were pushing pursuit of prescription privileges because you can license in a state that does allow prescribing for psychologists. And then since you're working under a federal umbrella, you could be in Fort Riley, Kansas, for example, allowed to prescribe under your federal capabilities. And it's the same thing, Jay, it's the same thing you're saying, that in a predominantly rural state, I mean, in Manhattan, Kansas, we've got 50,000 people. We've got a whole bunch of doctors. I think we've got 3 psychiatrists, and you just can't get meds. So everybody's going through their PCM, which is fine. But as a private practitioner, I would love to be able to be the one-stop shop and meet that need instead of going, yeah, go schedule it with your PCM and it'll take you 3 months, or you can go see a psychiatrist and you can wait 8 months if you want. And it's an access to care issue for me.
I completely agree with you. That's what drove New Mexico to be the first state that were able to pass that. And yes, it's a lot of work, no doubt about that. I remember that national exam was not easy by any means to take, but the whole program, it was well worth it. And I have physicians, I have for years now, they'll refer me patients. They want to know what I recommend medication wise. And I do a lot of patient education with psychotropics with my training. And and the patients appreciate that, give them the time to do it. While, like you say, a lot of psychiatrists are more, time concerned. They don't have the time to spend like, we do, for example. So I just hope it'll be a part of us as the years go by.
I'd just like to throw in my support as well. I guess that's quadrupling down now, but
That's
one of the things that I've really seen happen within the field, it's always kind of bothered me that people who are in psychiatry can do therapy like it's an add-on, but like they don't need specially training in that, and then we aren't able to
They
prescribe.
don't have any.
Yeah, they don't have any training. It kind of concerns me. But again, working in a very rural area, that gap is being filled, but it's being filled by psych nurse practitioners, and they have even less training in many ways. And I just feel that psychologists with our background, our broad background in psychology and behavioral health at large, if we also had the training to prescribe, I think we would be better clinicians than they are. And I speak as somebody who supervises our psychiatry program, which has 1 part-time psychiatrist and 10 psych nurse practitioners. And so I'm very much aware of the training that they have, and they have a very limited training on psychology. And I see them sort of overprescribing and misdiagnosing people because they don't have that fundamental underlying background that a psychologist could bring to the table. So I think with appropriate training in meds, I think psychologists could be phenomenal prescribers.
I'm obviously very biased. I definitely agree with that 100%. And again, one-stop shopping too, and patients don't have to wait near as long to see, one of us versus a psychiatrist. And I have a couple of very close nurse practitioner friends I work with now for 18 years, and they're trying to get full prescription privileges themselves. They have to have an MD supervise them, and they're knowledgeable, but they don't have the psychology background that you have or all of us have on the advisory committee. And so, but no, I'm really happy to hear from everybody's supportive of that. I thought I'd be the only one that would say something. So that's great.
Well, I'm glad that we're having this discussion. I know that it's one that can be a bit of a hot topic, and I would certainly welcome a welcome further discussion about this over the course of 2025. I do want to ask if there are other topics that folks would like to see the advisory committee pursue over the course of the rest of our calendar year. Anything else folks have any thoughts about?
I'd be open to continuing the conversation that we had last meeting on the clinical supervision and providing that through different licensures.
No, thank you, Chris. Yes, that let me write that down because that is something that those are conversations I've been having across advisory committees, and it's something that I think that we it would be good for us to take up. Anything else? Well, this certainly won't be your last chance to weigh in on this. You can absolutely email me or David or Leslie and let us know that, you know, there may be something that you would want to see the advisory committee take up over the course of 2025. And I can talk with Dave and discuss how we might want to structure these discussions around the topics that we've identified today. So that being said, it's 7:24, and that leaves us with just about 30 minutes, a little bit over 30 minutes to complete the training that was started in our last advisory committee. Before we move on, does anybody else have anything that they would want to add? All right, so I'll circle us back to point 6, and I'll have David take it away from where we left off.
Sounds great. Thanks, Richard. I'll go ahead and share my screen and we can finish the second half of the annual training for board members and advisory committee members. You may recall at the last meeting, we went through some slides and we talked a little bit about how the BSRB is formed as a public protection agency, the expectations for board members, the advisory committee policy, some guidelines for public attendees, and then, you know, some recent trends in terms of licensure. Now I kind of want to turn to some of the legal aspects of, as an advisory committee, we have certain rules we have to follow, and we'll talk about those. And so those pertain to state agencies, but also subcommittees of state agencies or standing committees like the advisory committee. So first, looking at professional licensing boards. Kansas regulates many professions through licensing boards or commissions created by the legislature to ensure professional competence and public safety. Boards are considered creatures of statute. This means that a board's power is dependent upon its authorizing statutes. A board can only exercise authority granted explicitly or implicitly by Kansas statutes. Boards cannot act beyond their statutory authority or on matters not addressed by law. Boards must adhere to constitutional protections, including equal protection, due process, and freedoms such as speech and privacy. Actions that are arbitrary, discriminatory, or that violate certain rights, like revoking a license based on a personal dislike, are prohibited. The legislature does have authority over the BSRB. The legislature has control, such as they could modify the enabling legislation, which would change the purpose of the board. They could limit expenditures in an appropriations bill. If we don't have money to operate, we can't fulfill our function. And also, the legislature could enact new legislation to change the makeup, scope, or powers of the board. If you want to look at the functions and duties of licensing boards, you can look at it under certain executive authority, judicial authority, and legislative authority. Under the executive authority, the BSRB does follow certain rules and laws, and two of the ones we'll talk about specifically are the Open Meetings Act, Tacoma, and also the Kansas Open Records Act, or KORA. Under the quasi-judicial authority, the agency does quasi-judicial hearings in reviewing facts when law violations have occurred. And it also follows the Kansas Administrative Procedures Act, or the CAPA, when appropriate. And we'll talk a little bit more about the CAPA. Under legislative authority, the board does have authority to adopt regulations to implement or interpret statutes with more detailed or specific requirements. And this process involves holding an open hearing on proposed legislation or regulations, allowing feedback, and there's oversight by a legislative committee that is known as the Joint Committee on Administrative Rules and Regulations, or JCO. Regulatory boards protect the public by ensuring practitioners are competent and authorized through the implementation and enforcement of statutes, regulations, and internal policies. Board members must understand the difference between statutes, regulations, and policies to effectively carry out their duties. So there is a hierarchy in terms of what we must follow. Statutes followed by regulations, followed by policies or internal guidance documents. So first and foremost, statutes. Statutes are laws passed by the legislature, signed by the governor, and derived from the Kansas Constitution. Generally, a statute will become effective on July 1st of the session year. And if you see a bill that says this will become effective upon, quote, publication in the statute book, ceremoniously, we're looking at July 1st. The actual physical statute book may actually be published a few months later, but we're looking at July 1st, unless there's another date specified by the legislature in that bill, such as publication in the Kansas Register, or let's say January 1st of a certain year. The statutes also define the scope of the board's authority to override any conflicting regulation or policies. And if a board requires additional authority, such as subpoena power, it must seek new legislation to expand the authority of the board. In terms of the secondary authority, regulations are rules adopted by a board to implement and enforce specific statutes. So a board's authority to adopt regulations is also derived from statute, namely the Rules and Regulations Filing Act, which ensures public and legislative input, consistency, and legal compliance are taken into account. Regulations fill in needs of statutes. They affect the rights and responsibilities of third parties outside of
right here.
And once adopted in accordance with Rules and Regulations Filing Act, regulations have the force and effect of law and are legally enforceable. For a regulation to be valid, it must fall within the board's statutory authority, implement a specific statute, and comply with legal requirements and constitutional standards. Regulations that exceed authority or conflict with statutes or the Constitution will be voided. And then the third level of hierarchy, policies and guidance documents. So policies may be adopted by a board only to guide its internal operations, such as prioritizing staff workload or explaining the investigative process. The expectations of board members document is a good example of a policy document. Also, guidance documents are documents that state a board's current approach to or interpretation of law, or general statements of policy that describe how and when the board will exercise discretionary functions. There's a few things to take into account when you're looking at being an effective board member or an effective advisory committee member. First, we would ask you, when you're reviewing the materials, to watch for conflicts. So be alert to an agency policy or an internal procedure that may conflict with the statutes or regulations or that impact applicants or licensees. And if you see something that you believe is a conflict, ask about it. And if there needs to be a change, don't be afraid to initiate action. If statutes or regulations are unclear or problematic, it's recommended to take steps to amend them or propose changes. In terms of discipline, one way to be effective is to understand that the purpose of discipline is to promote compliance and protect the public. And discipline should not be vindictive or disproportionate to the severity of the violation. It should ensure that discipline is fair and proportional. And then also, as sort of an overlying thing to remember to be an effective board member or advisory committee member in this role, the primary responsibility of the board is to protect the public, not licensees. Concerning professional activities, board members may hold office in a professional or trade association, but cannot lobby for or vote for matters or on matters that affect both the association and their role on the board. Board members must not use their position on the board to promote the interests of a professional association, and board members may attend professional conferences or social events, must avoid discussing board business when they are in a different role. If a majority of the board is present, they must not discuss the business affairs or matters relating to a particular pending application or disciplinary matter. And then also remember to comply with the open meetings laws or the COMA, and we'll go over into some of the requirements underneath the COMA. Concerning conduct, a board member or advisory committee member should not represent themselves as a spokesperson for the board unless authorized by a vote of the board to do so. If unauthorized to give the board's position on an issue, members must clarify that any opinions are personal, not official board positions. Board members should not ask board staff or counsel to provide legal advice or preferential treatment to any applicant or licensee. Now, dealing with one of the major laws, the Kansas Open Meetings Act, or the COMA. The COMA ensures public access to governmental meetings to promote an informed electorate. The purpose is to benefit the public, so the COMA is interpreted liberally and exceptions are applied narrowly to carry out its purpose. It applies to state legislative and administrative bodies, as well as to subordinate groups funded by public money. Subordinate groups are likely subject to COMA if created or extended by a covered entity. As an advisory committee, that is how the advisory committee is considered. The advisory committee meetings they are subject to COMA as well as the board meetings. The COMA does not apply to quasi-judicial functions or proceedings under the CAPA, the judiciary, private organizations, or staff meetings of covered entities. The goal of the COMA is to ensure transparency in government decision-making for the public. Under the COMA, it's important to understand a meeting. And we'll go through this first item here a couple times just to make sure everybody has a good understanding of what we watch for when it comes to COMA and potential violations. So under the COMA, a meeting is defined as any gathering or assembly in person or through the use of a telephone or any other medium for interactive communication by a majority of membership of an agency or public body subject to the COMA for the purpose of discussing the business or affairs of the public body. So we'll pause here and make sure that you're aware of these three components, and you have to have all three for the COMA to apply. First, there has to be a gathering by some manner. So that can be in person, by the phone, by electronic means. If there's a gathering where there is interactive communication, it could even be hitting reply all on an email and having that back and forth by electronic means. But if there is the interactive communication, you have the majority of the members of a certain committee that is subject to COMA, and then the discussion has to do with the business or affairs of a public body, then based on the law, that does need to be an open meeting. And so here's some examples that would not fall under the COMA. So if the members of the advisory committee wanted to go out to see a movie together, you don't have the interactive communication, you're not talking about the affairs of the agency, that would not be a violation of COMA, just because you're all there together at the same time. If there is half of the body or less than half of the body, and you want to discuss some items related to the advisory committee, that is also not a violation because you don't have a majority of the members of that group. So you need to have a majority of members, some sort of an interactive communication, and then it has to relate to the business or affairs of the public body. But if you have all three, you do need to follow the COMA. And just to kind of clarify through the presentation, it does talk about some other formats such as Zoom, Skype that would apply. It also could include things like informal discussions before, after, or during a recess of a public meeting, or all gatherings at any stage of the decision-making process. Work sessions or retreats are also subject to COMA. Discussion does not require binding action or voting. It can occur at social gatherings, retreats, or meetings held in private, and educational conferences and seminars. When traveling to such meetings, members of the board should avoid discussing agency affairs or business. The presiding officer is responsible for providing meeting notice, but that can be delegated, and so we take care of that on behalf of all the presiding officers for board meetings and advisory committee meetings. Notice is not required to be published in the paper or on a website, but individuals must request it, and requests for notice can be verbal or written and are valid for 1 fiscal year. The notice must include the meeting's date, time, and location, provided in a reasonable time before the meeting. The COMA does not require Robert's Rules of Order or any other similar format rules of procedure to be followed. The COMA does not require the board to create an agenda, but if one exists, it must be made available to the public. Meetings may be recorded if doing so is not disruptive. The public does not have the right to speak, but they do have the right to listen and observe, and secret ballots are prohibited in an open meeting. A board's policy may require minutes to be kept, but the COMA does not require minutes unless an executive session occurs. The motion to enter executive session must be included in the minutes. And concerning executive session in Kansas, there's actually a statute that outlines about 10 to 15 reasons why you can go into executive session. Some of the things, if we ever would go into executive session, it would be very clear. There would be a very formal motion, and it would actually state the reason why the board or the advisory committee is going to executive session. If you do go into executive session, it permits discussion of certain materials or matters outside of public view. It can also result, it cannot result in binding action, but a consensus can be reached, and any consensus reached must be formalized in an open session vote following that matter for it to be considered an official action of the group. If there is an allegation of a violation of COMA, that's a civil item, not a criminal item. Any person, attorney general, district attorney, for example, may bring an action in district court. An attorney or attorney general does have subpoena power, and enforcement actions take precedence over all cases and are assigned for trial at the earliest practical date. Some of the remedies for a COMA violation: it could void any action taken if prosecuted by the attorney general. It could be an injunction, stopping an action, a mandamus, forcing an action, a declaratory judgment, and then potentially you could have monetary fines. These are more rare, but potentially up to $500 per board member for each violation, ouster from office, recall from office, court costs assigned to the person seeking enforcement of the COMA, or vice versa, court costs assigned against the plaintiff if they maintain the action frivolously and not in good faith, or without reasonable basis in fact or law. So the important thing to remember at the COMA, these are requirements that are helpful to make sure that everyone can follow what needs to be done in an open meeting. On behalf of the BSRB and all the advisory committees, we do take this very seriously, and so we are not required to do as much public notice as we do, but we send out an email to anyone who has requested notice of meetings. We post information on the website. We also post information on a website called the Kansas Public Square, and all that information is out there. And then any of the information that you all receive as advisory committee members that we review at these meetings, that's posted on the website as well. So people can go and they can follow along and review that along with the members of the board or the advisory committees. Moving next to the Open Records Act, or the KORA. So the KORA mandates that state or public records be open for inspection by any person unless otherwise provided. KORA is designed liberally to promote policy, and public agencies include state, political, and taxing subdivisions, offices, officers, entities receiving public funds. The instrumentality is, while not explicitly defined in KORA, entities created or extended by a covered public agency are typically subject to KORA. For our purposes, the board and the advisory committees are subject to KORA. In terms of what constitutes a public record, any recorded information that is made, maintained, kept by, or in the possession of any public agency. It does not include records that are owned by a private person or entity, and the KORA does not apply to private companies, even if publicly funded for services, judges or courts, individual legislature or governing body members, or private individuals. Under the KORA, the board must appoint a Freedom of Information officer to assist with KORA requests, provide a brochure outlining requester rights, agency responsibilities, and procedures for inspecting and obtaining copies of public records, and include contact details for the records custodian, fees, and office hours. For the BSRB, Leslie Allen has been appointed as the Freedom of Information officer, and we do have a policy that deals with making requests under the Open Records Act. That is not just on the BSRB website under policies, but we also have a paper copy. If you ever go into the agency, go into our agency's office, you can see that when you first walk into our office. Anyone, regardless of residency, can request records. Individuals do not need to provide a reason for requesting records. The board may require requests to be written with the requester's name, address, and proof of identification. And the board can also require the requester to sign a written certification that the requester will not use names or addresses obtained from the records to solicit sales or services. The board cannot deny a person the right to review public records unless closed by law. And then if portions of the record are closed, the remainder must be made available to the requester. For example, if there are certain records where you can make redactions and then provide the rest of the record, it is expected that you will do so. The board is not required to make copies of the following unless shown at a public meeting: recording tapes or discs, videotapes or films, pictures, slides, graphics, or illustrations. Requests can be responded to within 3 business days with 3 possible responses. First, either the record is provided in the form requested if possible. Second, the request is under review and the records will be provided if permitted. Or 3, the request is denied with a detailed explanation for the denial. Public records must be released unless an exemption to disclosure applies, and the burden is on the board to provide exemptions. Exemptions can be discretionary or mandatory. And then based on the law enforcement, similar to the COMA, it's a civil act. Any person or attorney general can bring a civil prosecution. They do have subpoena power. Similar to the COMA, if there is a finding of a violation, some of the penalties can include fines up to $500 per violation may be imposed, but it would have to be a knowing violation or an intentional failure to furnish information. And costs and attorney fees may be imposed if a denial is found to be in bad faith or without a reasonable basis in fact or law. And violations are subject to trial at the earliest possible date. The COMA establishes procedural, that is the QORA that we just finished talking about. An important takeaway from the QORA, we have moved to more of an electronic age. Traditionally, what we would remind people of is we trust that they're going to be formal when it comes to written letters, but sometimes people are a bit more casual in terms of their dialogue over email. So we always just say, in terms of your interaction as a board member or advisory committee member, just make sure to be very cautious and make sure to keep things professional in your correspondence, because any of those emails could be considered a record and that could be published in the paper. So I think members do a great job with this, but it's always helpful just to do a yearly reminder about that topic. Moving next to the CAPA, the Kansas Administrative Procedures Act. It does establish procedural rights and duties. It does not provide substantive law. Substantive laws are governed by the board's Enabling Act or Licensing Act. And the CAPA applies only when explicitly stated by other statutes. It governs procedures for board decisions when specified in a licensing or enabling statute. It ensures the board operates efficiently and in accordance with the law while balancing public access where appropriate. And licensing boards must conduct business under the COMA during open meeting parts, but when the statutes direct decisions to be made under the CAPA, the board will follow the CAPA rather than the COMA. And so the best way to explain when we use CAPA is to kind of show the difference between what would be an open meeting under COMA versus a closed session under the CAPA. And we'll talk about a few examples of that. So the CAPA sets out a procedure to follow when the board is deciding what to do in cases involving individual licensees. In these cases, the board conducts a quasi-judicial function in deciding the outcome of a case. It does not require public notification for licensure application reviews or CRC meetings. That's the Complaint Review Committee. And that includes probable cause determinations or summary proceeding orders. So if someone goes before the Complaint Review Committee for a violation and the members of the CRC decide that there has been a violation and they issue an order, that is not an open proceeding. But if the person requests a hearing, the hearing is an open proceeding, and that's the Office of Administrative Hearings, and that's when things will be open. Like it says here, only hearings need to be open for the public under the CAPA. Decisions are made upon issuance of a license or order, and public voting is not required. During the CAPA proceedings, relevant board staff or legal counsel may attend to provide necessary information and legal advice to board members. Some of the board activities that are not covered by the CAPA and must be acted on in an open meeting most of the activities of the board. So things like approving board minutes, deciding whether to renew contracts or change the way contracted services are provided, delegating authority to a board member or executive director, discussions and votes to approve or amend regulations or guidance documents, policy decisions affecting the way the board operates internally, receiving agency updates regarding a number of different matters. That would all funnel under the COMA, and those would all come under an open meeting. But when we're talking about a CAPA procedure that's looking at one specific individual, another thing we talked about was the Complaint Review Committee if someone has a violation or they have an allegation of a violation. The other would be if they're applying for licensure. And so concerning the application process, applicants have the burden of proof, and staff will collect necessary information for the board to assess whether the applicant qualifies for licensure or if conditions or restrictions apply. If the board conditions, denies, or restricts a license, the applicant may request a hearing unless agreed to in a consent agreement in order. In terms of investigation, the board has the burden of proof to show a licensee has violated statutes or regulations. And licensing boards can investigate complaints with the investigator presenting findings to the CRC. The CRC determines if there's a probable cause to believe a violation has occurred based on reasonable grounds. And reasonable grounds are basically information that would lead a reasonable, prudent person to believe that a licensee violated one of the board statutes or regulations. For the investigations of the board, the CRC must ensure the licensee's conduct that they are accused of actually violates one of the board statutes or regulations. A licensee doing something that made someone angry, violated a professional association's ethical code, or did not follow an employer policy does not necessarily mean they're violated a statute or regulation. Licensees can request a hearing within a certain prescribed period of time, and once a petition or request for a hearing is filed, the CAPA guides the proceedings in the hearing. In cases where there is immediate danger to public health, safety, or welfare, the CRC may suspend the license without giving the licensee notice or an opportunity for a hearing, and the licensee may appeal an emergency order to the district court. So, as advisory committee members, most of your interactions will not deal with the CAPA. Most of our meetings for the advisory committee are going to be open meetings under the COMA, but if we need to get into this realm, we will remind individuals that we are entering a closed session under the CAPA, but likely it will involve mostly board interactions, either reviewing individual license applicants or individuals concerning a complaint. The last major topic that we'll talk about during the training is the Kansas Tort Claims Act. And I have not seen this come up during my time as executive director for the board. I'm in my 5th year as executive director, but I do think it's important for all of you to be made aware of it. Should it come up, there are certain timeframes you need to be aware of. So the Kansas Tort Claims Act governs liability of the state of Kansas and its agencies and employees, including board members, elected or appointed officials, and others acting on behalf of the government. So it does include advisory committee members. The Tort Claims Act establishes vicarious liability for wrongful acts or omissions within the scope of employment with potential case-by-case immunity. The thing to take away from the Tort Claims Act is if you are sued for actions that occur within your duties as a board member or advisory committee member, the state will defend you at no cost. However, to obtain representation by the state, you must submit a written request within 15 days after service of process. You must include a copy of the petition and summons and cooperate in your defense. And the state may choose not to defend you if you acted with actual fraud or malice, failed to make a timely request for representation, or the judgment is for an act or omission that occurred outside the scope of your duties as a board member. So like I said, the Tort Claims Act has not come up since I have been with the agency. I hope it never does come up, but should you ever get an email that you are being sued because of your role as a board member or an advisory committee member, please reach out to me at your earliest convenience, and I will put you in touch with the right entities, and we'll make sure that we take care of you in terms of your responsibility as a board member or an advisory committee member. In conclusion, for the entire training, we would strongly encourage you to become familiar with statutes and regulations for the different professions. I realize that's a lot of material. So start with the statutes and regulations for the licensed psychology profession. And then if we're looking at a specific area, maybe look at the regulations for a couple other professions, just for comparison. We try to do this as well to give you some updates or highlights. So if there's things that are in your regulation that are not in others, you're aware of that, or vice versa. If something is missing or is not included, but other professions have that, we want to make you aware of that because that could be a possible recommendation. We recommend that you review the policy documents, including the expectations for board members, advisory committee policy, and guidance for attendees of meetings. We recommend that you become familiar with the BSRB website, the YouTube channel, other resources available for you to use as a board or advisory committee member. And the website again is ksbsrb.ks.gov. It's also a good idea to strive to uphold the values for board members and advisory committee members, and at the same time being mindful of the laws and requirements related to state agencies such as the COMA, the CORA, and the CAPA. And then my contact information is here. You should have a copy of this presentation. It's also posted on the website. But at this point, I'll go ahead and stop sharing my screen and see if there's any questions on the training. But before I take questions, the thing that I usually get the most questions about after the training has to do with the COMA. I think individuals want to make sure they don't accidentally violate the COMA, which I appreciate. One thing to remember, you can always send one-way communication. So as long as there's not the interactive component of the back and forth, then you're fine. And one way to ensure that we keep it one direction is that most of the communications from the advisory committee come through me directly. So if you want me to distribute something to the other members, feel free to send it to me and ask me to forward it along, and then I can forward it to all of you. You are always able to contact members of the advisory committee. It just becomes a problem if it involves the majority of members. And so, like I said, don't hit reply all and have the communication back and forth. But if you ever want to reach out to Richard as chair, or to me, or to Leslie Allen for any assistance, please feel free to do that. Occasionally I hear from the training that people are so concerned they don't want to violate the rules that they're not sure if they can reach out to any members of the committee after the meeting. And I don't want you to feel like you're trapped. I want you to feel like you can always reach out to other members. It's just making sure that if something involves the majority of members, that that's something the public can view. But if you ever have questions about those requirements, please let me know, and I'm happy to go through that until I want to make sure that you're comfortable with your responsibilities here. Any questions on the training materials or other things that we talked about? If not, if you do have questions that you think about over the next couple weeks, feel free to just send me an email, and I can try to help you out that way. Or if you want to set up a time, we can have a phone call or further conversation that way.
Thank you, Dave. I appreciate it. And we have reached the end of our time together. I will take a motion to adjourn.
I motion to adjourn.
I can second that.
All right, we have a motion and a second. All those in favor do say aye.
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 I don't think there will be any opposition to that. Our next meeting, we will revert back to our normal time, and that will be Tuesday, the 8th of April, 2025 at 6 p.m. So until then, you all have a good rest of your night. Take care.
Thank you. Bye.